International Communications at St. Louis University, Madrid. I would like to introduce our next startup, an extremely devoted team of entrepreneurs from São Paulo focused on the healthcare industry in Brazil. They're very passionate about their product, and we think they'll have the medical industry very excited. Please welcome Ricardo Moraes.
Good evening, everyone. My name is Ricardo Moraes, and I'm the CEO and co-founder of Memed, a digital platform that enables Brazilian doctors to access medical and drug information in real time. Last year, I went to the dermatologist. It was just a regular checkup, and at the end of the appointment, the doctor gave me this. I looked at the doctor and I said, "Man, are you serious? How is the pharmacy going to understand this?" Now you may think, that's no way to speak to your doctor. But in this case, the doctor was my brother, Rafael. I realized that his messy prescription was just a small part of a bigger problem involving doctors, patients, and pharmaceutical companies. Rafael found it impossible to stay up to date with the latest drugs information. Although there's a lot of new drugs on the market and a massive amount of new research, there are no user-friendly tools to access this information. And as a result, doctors like my brother wind up prescribing the same old medicines they learned about in their medical school. This also poses a big problem for pharmaceutical companies, who lack an efficient digital channel to connect with doctors. Pharmas invest heavily in pricey medical conferences, an expensive sales force, a system that is ineffective and often leaves doctors overwhelmed. And at the end of the day, it's the patients really suffer. In Brazil, 70% of all medical visits end with a prescription. That's over 35 million prescriptions per month. But between errors prescribing the correct medicines, pharmacy mistakes, and handwritten prescriptions, it's estimated that 75% of all those prescriptions have errors. Internationally, web-based health tools are now becoming commonplace, but Brazil has lagged far behind, until now. With Memed, we are building a powerful platform, a suite of tools that provides doctors an indispensable resource to get access to updated information, an easy-to-use prescription tool, a live chat function, and powerful notifications. Let's take a look at how Memed works. By making a few quick selections, doctors can find up-to-date information of the exact medicines they want to prescribe. If they have diagnosed the problem, but are not exactly sure which drug to use, Memed will give them more information to make the best decision and reduce their chance of error. And now, we are launching 2 new features. Memed Notifications, a system that allows doctors to receive personalized notifications directly from the pharmaceutical companies with the latest information about drugs and studies. And Memed Live Chat, which allows doctors to communicate directly with pharmaceutical companies and drug makers. And with Memed Prescription Tools, makes it easier and better for doctors to make safer prescriptions and more precise to better serve their patients. Our primary revenue source comes from putting pharmaceuticals in front of doctors. Pharmaceutical companies will be able to promote their content more effectively, like never before possible. And we track our user behavior and generate anonymous online reports detailing the prescribed medications and doctors' responses to ads. Memed Analytics is our back-end reporting system that provides real-time demographic data. This is a powerful tool to pharmaceutical companies to better customize and target their advertisements and marketing efforts. To give you an idea of how lucrative is this market, pharmaceutical companies spend 30 to 40% of all their sales on advertising to doctors. Last year, this resulted in $9 billion spent on marketing, which is our total addressable market. We have an international benchmark, it's called Hippocrates. They have 340,000 active physicians registered, and 96% of those physicians changed the prescribing decisions because of the information available on the app. The Hippocrates users, 61%, reported they launched their mobile app 3 times a day. Last year, they generated $110 million in revenue, and 7% of this came from advertising. In 2012, they were acquired for $300 million. We are currently running an open beta version with the dermatology segment. We organized over than 1,200 products from 46 different pharmaceutical companies into a convenient searchable drug directory. Recently, MedMed closed a new partnership with Dermage, a prominent company of manipulation formulas, to give dermatologists the newest and most incredible content about manipulation. And I'm very excited to announce that we just converted over 1,000 dermatologists into registered users on MedMed, which means we're getting closer to 20% penetrations in all Brazilian dermatologists. They used our platform to make more than 8,000 prescriptions, with over than 10,000 drugs prescribed. Also, we are now developing our first mobile app. We'll be ready to launch in a month. I'm very happy to be developing MedMed with such a talented team. We came together with this unified vision to change the health industry in Brazil. And I have the pleasure to work with René, our CTO, and Marcel, who leads the product development. And that's not just me that think our team is great. We are recently selected to Endeavor's Startup Network, which gave us access to Endeavor's incredible network of successful entrepreneurs. We are seeking 700,000 reais to grow MedMed into more medical specialties and build new features that our clients have been requesting. We want to offer doctors the best health experience, so they'll be fit to give patients the best care, and we are working hard to make it happen. Thank you.